Assalamu alaikum. I am Dr. Silvia Paroi, Assistant Professor of Community Medicine Department at the Akij Medical College, Khulna. Today we see ventilation. What is ventilation? Modern concept of ventilation implies not only the replacement of vitiated air by a supply of fresh outdoor air, but also control of the quality of incoming air with regards of its temperature, humidity and purity, with a view to provide a thermal environment that is comfortable and free from risk of infection. Now we see some standard of ventilation. Most of the standards of ventilation have been based on the efficiency of ventilation in removing body odor. It has some criteria that cubic space. Different workers have advocated standards for the minimal fresh air supply ranging from 300 to 3000 cubic feet per hour per person. Now consider that a space of 1200 cubic feet per person is quite sufficient. Second one is air change. It is recommended that in the living rooms there should be 2 or 3 air changes in 1 hour. In workrooms and assemblies 4 to 6 air changes. Third one is floor space and height of room. Floor space per person is even more important than cubic space. Heights in excess of 10 to 12 feet are ineffective from the point of view of ventilation. The optimum floor space requirements per person vary from 50 to 100 square feet. Now we see some types of ventilation. There are 2 types, natural and artificial. Natural ventilation, that is the wind. Wind is an active force in ventilation. When it blows through a room, it is called perflation. When there is an obstruction, it bypasses and exerts a suction action at its tail end. This is called aspiration. Doors and windows facing each other provide cross ventilation. Second natural ventilation is diffusion. Air passes through the smallest openings or spaces by diffusion. Third one is inequality of temperature. Air flows from high density to low density naturally. The outside air, which is cooler and more dense, will enter the room through inlets placed low. In the tropics, the outside air may be hotter than the inside and the reverse may take place. The chief drawback of natural ventilation is that it is not possible to regulate the velocity of the incoming air nor to adjust its temperature or humidity. Now we see mechanical ventilation. Mechanical or artificial ventilation may be of the following types: exhaust ventilation, plenum ventilation, balanced ventilation and air conditioning. Now we see exhaust ventilation. In this system, heated light air is extracted or exhausted to the outside by exhaust fans, usually driven by electricity. As air is exhausted, a vacuum is created which induces fresh air to enter the room through windows, doors and other inlets. Now we see plenum ventilation. In this system, fresh air is blown into the room by centrifugal fans so as to create a positive pressure and displace the vitiated air. Third one is balanced ventilation, that is also mechanical ventilation. This is a combination of the exhaust and plenum ventilation system. Now we see air conditioning. Air conditioning also one type of mechanical ventilation. Air conditioning is defined as the simultaneous control of all or at least the first 3 of those factors affecting both the physical and chemical conditions of the atmosphere within any confined space or room. These factors include temperature, humidity, air movement, distribution, dust, bacteria, odors and toxic gases, most of which affect in greater or lesser degree the human health and comfort.